Hey, Curtis. I can't hear.
Hello, Marvin.
Hello,
Ah,
hello,
Daniel.
hello, hello. Can you hear me now?
Hello. Yes, I can. Thank you.
Okay. Is there any drag or noise distortion, or is it clear?
I hear you clearly.
Okay, perfect. Perfect.
Hey, Mustafa.
Hey, Marvin, how are you?
I'm hanging in there. Busy week.
Always.
Yes.
Four, 6, 8, 10. Okay, Daniel, you're gonna need to let the people in who's in the waiting area, and then take Kristina off of mute so we can be able to hear her. Okay.
And I can't recall in what place I am mute. Oh, that's dorsal.
Where is she?
Oh,
Thank you.
thank you,
Do you have a
Kristina.
quorum? I
Thank you,
can't see
Curtis.
who's
Yeah, I would say we can wait just another minute. We have. It looks like we do have quorum by one.
Thank you. I
Rough
want to
estimate.
welcome everybody today to our November System Performance Committee, and it's going to be changed from the posted agenda. We've had something critical that has come up, so we are working on off a new agenda, which has to do with the NOFO being released a week ago, and that's where. And so I want to again welcome everybody. And if I got you on the phone, thank you for taking my call today. I tried to reach everybody from every secretary I could find at King County to Lutheran Services heard me too. So trying to make sure that we have a quorum for today's meeting. So I'm going to go ahead and just move it over right over to Daniel so he can take us on this because I don't have a different agenda printed out.
Should we move to accept a new agenda at this time to make sure that we followed our process for agenda changes? I would so move that we adopt the
We
agenda.
could. I've never done that one before. never have
Yeah.
had a last minute agenda change, so I didn't know we had to do that.
I second that. This
Thank
is
you.
Ruby.
Ruby. Can't hear you, Curtis. You're muted.
Curtis.
No, I know. Okay, first, before we do, any motions or anything, let's first, do roll call. Okay?
How about that? Yep.
All right, let's start it off. Is Sherry here?
Sure.
Okay, is Ruby here?
Here.
Marvin, you're here?
Yep.
Dina, you're here? Frank? No. Ben?
Here.
Okay, Victoria?
Here.
Tamara?
Here.
Mustafa?
Present.
Shawna? Okay, a no on Shawna for now anyway. Okay. So that is a 9 people, so we have quorum,
We have everybody here.
except for 1 or 2. Shawna and Frank, I believe.
And one person is no longer, Frank is no longer with us.
Oh,
And
okay.
so Frank has left us, so he is not with us. And I didn't have Shawna on as an appointed member. Is that true?
Shawna is a member. I just emailed to see if she can join us.
Okay.
We have one.
Okay, so we do have quorum, so we can
Okay.
move forward.
So
Okay.
now we've got it, Peter, let's move it over to Daniel's for some really important business.
I would
Okay.
still say
Oh,
that.
first,
we vote-
let's vote the new, I'm
Thank you.
so excited about working on the new business.
Okay, so first,
Yeah, let's go ahead and first do the.
let's approve last month's meeting
Yeah,
minutes.
this
Let's
is
do
all
that.
new. I've been in this system performance committee for 11, 12 years now, and we've never voted on agenda and done this kind of stuff. So we're changing it a little bit around. So getting more
Well,
formal. So
But when I
maybe
look on the, when
Daniel
I
can
look
tell
at our
us about what our new
webpages,
agenda is.
okay, when I look at our web pages, at the web page, and you click on the tab for previous month's meetings, there has been included minutes and agenda approval over some of those meetings, not all of them, but over majority of them, which according to protocol, a meeting that you have to establish quorum and things of that nature, that is normally part of that protocol. When you have in the
We have
meeting.
not done that before. That has not been this group for the past ever. And so that we were going to look at changing up our bylaws and adding that. We have never done that before.
I disagree.
And a
We
lot
have
of
done
stuff has
that
been
before.
added to the website that we have not voted on nor approved.
I disagree. We
group.
have done that before.
So that
Yeah.
you know that has never come to this SPC group before to ever for us to decide upon either. And that is something we are going to look at next year, looking at what is put there versus what we have done as a group in the past. So just because KCRHA has put that there doesn't mean we have voted on it as in a group and agreed upon that we're going to be doing that. So
So
just
with
so you
respect,
know.
can we just follow protocol? You keep
And as far
talking
as
over
that, I
Curtis.
will also tell you what's on the website is not ADA 508 compliant. So just
Listen,
so that. So
I'm gonna leave.
we are going to
This
be
is not
looking at
acceptable.
next month or in just January through March, updating our bylaws and looking at what we want as a group to do and not to do.
Kristina, can you hear me at all?
Go ahead. I see your hand, Marvin.
I'll pass to Ruby for the moment. I do have a comment. This conversation has gone differently than I had originally planned. One is that we posted an agenda for this SBC meeting. We're to the public. We're not going to be necessarily following it because we're going to be handling emerging business.
Yes.
Simply moving a move to accept the agenda for today is that we're all clear that we will be doing that work, not what we had originally proposed. So Ruby, I'll give it over to you.
Yeah, I'm sorry. Can you all hear me?
Yes.
Yes.
Okay, I just wanted
Yes.
to make sure that Ben was able to be heard, or that we were able to address that, because I wasn't sure if anybody could hear Ben when they were mentioning. So I just wanted to uplift Ben if he's still here.
Thank you. I'm here. So I feel like Curtis keeps getting talked over. It's very disrespectful. We have absolutely voted on approving minutes prior. I've been here for a year and a half. We've done it every time. I understand that we're excited that there's new business, but we have quorum by one. And if we're going to be disrespectful to one another, then we're going to lose quorum because I'm going to leave.
Okay. Well, now that cooler minds are prevailing. Okay. So let's go ahead. Vote a motion to approve last month's meeting minutes. All in favor?
Aye.
Aye.
Oh, okay. Okay, well, okay, hold on. I need someone to present the motion, then someone to second the motion, and then we can.
Motion to accept last month's meeting minutes.
I second
Okay,
it.
that was Marvin. And who second?
Sherry.
Thank you, Sherry. Okay. All in favor of last month's minutes, say aye.
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 Any nays? Any abstention? All right, the nays have it. Thank you so much for your cooperation.
Okay, well, thank you, everybody.
I would like to reintroduce the motion to accept the agenda for
Please do.
today. I believe Ruby seconded me, and if this is the portion, then we can get our work started, I hope.
Yeah, I seconded that.
Thanks, Ruby.
All in favor, say aye.
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 Any nays? Any abstentions? All righty, our new agenda motion passes. Thank you. We can get down to the business at hand now.
Great. I want to, if you could mic Curtis, and then I can
Mhm.
go. Thank you. Thanks, everybody. We had a little bit of a friction there starting. I'm so happy that everyone is staying. And let's get started because we do have some critical business today. Thank you, Kristina and Tamara.
Danielle, do you have an echo in your voice sound? So I cannot hear you.
I do have
I
an
don't know
echo.
if anybody
Curtis,
here
can you-
does.
I am muted.
I'm not seeing that on my end. I can mute you.
Okay.
Is that better, Mustafa?
Yes. Much
Okay, great.
That's what was up.
And I think what would be really helpful, because of the nature of today's meeting, I know that we're all looking forward to the details that I'm about to provide. If you could just raise your hand to speak, and let's use that this time. I know that's not a usual thing, but just so that everyone gets an opportunity. We each represent and are delegates for the communities that you serve. We want to hear you today. We want to get feedback that's going to be really important. So let's do this sort of in a very self-organizing way by raising our hands. And then I'll be looking at chat. I have Catherine here helping with that. So we will make sure that we get everyone's voices heard in this process. That's really, really important for today. So I'm going to jump right in and describe a little bit about the agenda change and why that happened. So we've been anticipating the notice of funding opportunity. This is colloquially called the NOFO, or you might have heard the NOFO dropped. What this means is that HUD has put forth the application for continuums of care like ours to renew projects, add new projects, essentially outline how they're going to use the next year's funding from HUD. I'm going to have here shortly Kelsey Beckmeyer, the COC manager, along with Catherine Totter here. They're going to, Kelsey's going to be walking us through some of those details. And before she arrives, I'm just going to share that the deadlines that came into us last week. Some of you received a quick presentation on some of the criteria changes. We're going to go over that today. They're different than what HUD has put out before. So we're it's all hands on deck at KCRHA, looking at those and figuring out how we can be creative to use that funding for the projects that we have, and how do we use our ranking and rating process and apply that in a way that meets those requirements from HUD, knowing that the criteria has changed and is different. And so with that, we changed the agenda today. This is the last COC committee in which we can review. Hang on, I'm just going to pause for a second. Sorry, I lost my train of thought there. So when Kelsey joins us, she'll be going through those details with us, and we're going to want to hear from all of you. I would really like for everyone to be open-minded, think creatively. I know this group can, and I know everyone here has a background in problem solving. You're all problem solvers. That's why you're at the table here today. That's why you care so much. And I really want you to bring all that to bear as we talk today about the NOFO. With that, I do not want to skip our open comment period. I know we have people waiting. I would like to go to that, hand it back over to Kristina, and then between now and that time, we should have Kelsey joining us to guide us through the NOFO changes and the decisions that this group needs to make. I'll hand it back over to you, Kristina. And then I think we did skip the land acknowledgement. I'll leave that up to the co-chairs for that.
I don't actually have a land acknowledgement pulled up, but if someone else does, I'd be happy to share it. Otherwise, I think we should proceed and basically acknowledge that we are on the unceded traditional lands of the Duwamish and Coast Salish peoples. They are the stewards of this land, and we are blessed and honored to be present on this land. So we honor and respect our ancestors and the land upon which we are here today. And that, I guess, is my impromptu land acknowledgement. So let's proceed.
Kristina?
Did we lose her? Well, should we proceed with opening public comment at this time?
Yeah, I think I see one hand.
Okay. Can everyone hear me?
Yes.
Yes.
Okay, so we will now accept public comments, and it appears as though Mike Mathis has his hand raised. Can you unmute yourself, Mike?
Now I can. Hello. Can you hear me okay?
Yes.
You are now unmuted, Mike, but we
Thank
can't, I don't hear anything anyway.
Oh, you don't hear me?
I can hear him.
Okay, well, I'm just going to go, and hopefully the recording will pick up for whoever.
Yes, go ahead, Mike. I'm sorry.
All right. So yeah, my name is Mike Matthias. I'm the executive director of Anything Helps. A lot of you already know me. The NOFO presents kind of a unique opportunity for us. I think they're, from what I can generalize and gather from the information that's publicly available, it sounds like, around 70% of funding can be classified as transitional housing. And, to be frank, like when you look at the evidence-based practice of permanent supportive housing, it is not what we do today. HUD really muddies the waters when it comes to what permanent supportive housing actually is and what the evidence-based practice is. And the evidence-based practice, I'm a lead fidelity reviewer with the Washington Healthcare Authority on it, and it specifically distinguishes a separation of housing and services, and that's not something we do. As a result, like it or not, I think we need to face the reality that the PSH that we currently offer is inherently transitional. We have a lot of people abandoning their units. We have a lot of people passing away in their units. We have a lot of challenges with PSH. And, the definition of transitional housing is, maximum, I think it's like 24 months is the norm, the normative maximum. But there isn't like an actual maximum. So I think a creative solution could be, at least in this regard, is to, look at what the actual evidence base tells us works, says that community-based services work. You can rescope your NOFO to suggest that you're, turning this housing into transitional housing. And, essentially the people that are on leases, you would just ask them to sign a mutual lease termination and allow them to continue to live there for up to 24 months. And then, I don't know, shift units around if they surpass that and these rules still apply. But I mean, we can think of creative solutions to get things maintained. It's doable and it may even be better. So I think that there are ways to go about it. So don't hesitate to reach out if I can be helpful. But I think you guys have got this. There's a lot of creative outlets for this. That's all I wanted to say.
Thank you, Mike. All right, well, I think that ends our public comments, unless there's someone else. Okay, it doesn't appear to be. Okay, we can now move on to the next portion of our agenda.
Hi, this is Tamara. I guess as we transition, I just wanted to thank Mike for that comment, that kind of reframing of what is essentially a horrific moment in history. I think that perspective, putting that, I think I just really kind of like that optimistic frame. We are going to have to be extremely strategic with this NOFO, and I just thank him for bringing hope to the table, and I hope that other people can kind of mobilize around that too. Okay, let's rock this.
Great. Kristina, we have you back.
No, I'll try texting her or calling her right now.
Okay.
Okay. And we're gonna just take a minute here and see where Kelsey's at and get her on. Thank you.
Yeah, it looks
Thank
like
you
she's.
all.
Oh, sorry. She was maybe knocked out of the meeting somehow. Are we able to resend her the link? Or?
Yeah, I had unmuted Kristina, and then I think I don't know if connections are what they are. If she wasn't able to reconnect.
Okay.
But I'm on the lookout. I just want to just ask for everyone's grace and patience right now. Part of the criticality of this is that because of those tight deadlines. I know that the program staff, KCRHA, obviously, has been working tirelessly since the NOFO dropped to get something together, and I know that she is trying to get all of that really in the past 48 hours, really to get something for us. So I think she's probably clicking submit and final document, and I think she's going to show up with all that work. So thank you for your patience here.
I think I saw her pop back online.
Kristina, can you hear us?
Well, I'm deaf. I'll never be able to hear you, but captioning is coming through.
Okay, well, we can hear you now. So, okay, good deal. Okay. So, Kristina, we just finished the public comments portion of the meeting, and we are now ready to move forward with the first agenda item.
I don't have an accessible form of the agenda, so Daniel has to go on
Yeah.
with it.
Yeah, Kristina, you just kind of missed the last 30 seconds. We are just hovering in the wings, waiting for KCRHA to join. She's going to be guiding us through. I think she's kind of doing some last minute, putting some things together so that we have a full scope of what we're embarking on here. And she's going to be putting together some timelines for us. I think she's just kind of just skidding in on the way because of these really tight deadlines that we got from HUD last week. So this meeting was scheduled to look at some other agenda items, some survey, training data, our work plan for 2026. We're going to pause those until January, which is still in line from last year. We voted on those things in January, so we're still going to be in a good spot. But with that, clearing the agenda, again, just reiterating, those of you who already probably heard this, we're going to be looking specifically at the new criteria for the NOFO application and some updated reconfigured criteria. And those are going to be the areas that we're going to focus on. And as soon as KCRHA joins, she's going to walk us through those. And then a little bit unexpectedly, we are going to be asking for your endorsement for this. So I'm really encouraging everyone to write down your questions as they come up. Please do remember to raise your hand. There's a lot of us here, and there's going to be a lot of thoughts and reflections and comments. Let's try to keep those as organized as possible. We want to jot those down. I know Curtis is going to be supporting note-taking, as well as Catherine, myself. And then obviously we're being recorded as well. So we're going to be, we want to make sure that those who are listening in or will listen in get the full details of everyone's thoughts and representation that you're bringing to the table as we make this this important decision and an unprecedented NOFO, really with very little notice. And it looks like KCRHA here is going to be joining right on the dot at 2:30. Is that right, Catherine? Okay.
Can we start with like initial reflections while we're waiting for the presentation? Or is
Yeah,
that
I think so.
Oh.
Yeah, sure. If you'd like to.
Okay? Well, I mean, I have a lot of reflections, but I would like to see how others are reacting to the content. Just to have that a little bit of that open dialogue until we are until we receive the information that's going to define, you know, kind of how we go forward together? Be.
Yeah, thanks for giving us some time for that, Tamara. I think it's a great idea. I think that, you know, as we know, this administration's rather intentional about the things that they are doing. And so I just hope that we can be, you know, in a positive mindset and try to bring community together on this topic. Because I think that, you know, regardless of what programs are or not able to be kind of funded or looked at in the right way that, or in the way that we've been looking at them over the years, you know, we're just going to have to get creative. And that's my initial response, is that we have to be very creative here.
So true. And for me, getting creative is managing my managing my reactions and responses to things that are dumb. Yeah. Anyways, we see that Kelsey's here. Yay.
Hello, all. Pardon my tardiness. I appreciate you holding down the fort as I wrap up some other conversations.
No worries. Thank you for being here.
Yeah. As I have just jumped in, are you ready for me to go?
Yeah, Kelsey, we have
Okay.
done all of our administrative duties. We've got quorum. We started out very energetically this today. We're all anticipating kind of your guidance as you walk us through, and
Beautiful.
appreciate everyone's comments so far. We'll hand it over to you, Kelsey.
All right. I am going to pull up some slides to share with you all. Will you just confirm that you can see my slides?
Looks good on my end.
Yes.
Fabulous.
Yep.
Thank you. Well, hello, everyone. Kelsey Beckmeyer, she, her pronouns. I am the COC manager with KCRHA, and wanting to provide both an update to the System Performance Committee today around the NOFO, particularly around rating criteria and rating criteria changes, to seek your endorsement for us to move forward with changes in order to have as competitive a rating and ranking process in HUD's view as we possibly can, so that as we go forward with the FY25 NOFO, our continuum of care can be as strong in its application as possible. I want to start off with a little bit of what we know. So first, what we know is we are in the midst of beginning the renewal process with HUD for fiscal year 25. Our total ARD, or annual renewal demand, this is the amount of money that HUD is telling us, you have this much money for projects that we know you want to renew. And that amount is $65.5 million. The other piece that we know is that there have been embedded caps on that $65 million. The first is that 35% of that total is able to go to permanent housing projects. That is inclusive of permanent supportive housing, rapid rehousing, and joint component transitional housing, rapid rehousing projects. We also know that there are going to be tiers in terms of how we rank projects. HUD historically has had a tier 1. This is the relatively, are my slides going forward?
No.
They
Yeah.
are
I'm not
not.
seeing that.
Oh, because something happened to my computer. Are you seeing the slides now?
We
Well,
can
we
see the like
your
first
slide and we can see your cursor moving, but the slides are not advancing. Maybe if,
Oh,
there we
Oh.
go. There we
okay.
go.
Do you see like a whole like the PowerPoint
Yeah.
You know.
It's
Oh,
not in presentation mode.
it's not going. Weird. Okay.
If you click
Let-
on them though, Kelsey, we do see the content.
Okay. Great. Well, we will just make it work this way then. Okay. So pardon me. Here is the slide I'm talking about with the ARD, etc. So back around the tiering, HUD has historically asked communities, COCs, to put their priority list of projects into tiers. The first tier is pretty historically relatively safe. Like, we are going to fund these as long as they pass, a merit review or a threshold review. You're renewing these projects. We trust you. We're likely going to fund these projects. Tier 2 is funded then based upon what is called now a merit review. So that's the consolidated application that we submit to HUD along with the projects. Based on that score, they'll start funding tier 2 projects with the highest scoring COC to the lowest scoring COC based upon how you rank things and available funds. Tier 2 is the risky tier. That's we could lose this funding, we could get it funded, depends on how we score. Historically, we have had majority of our projects in tier 2 that are renewals funded. Last year, tier 1 was 90% of our ARD. So the total that we could renew, 90% was pretty well guaranteed to be renewed. This year, that is 30% of our ARD. That is decently able to be renewed. The other piece that we know is that new projects that will be prioritized by HUD are transitional housing projects and supportive services only, either a standalone where perhaps it's a housing navigation case management based in a shelter, or a street outreach project. Majority of our funding at this moment in time goes to permanent housing projects. Over 85% of our funds go to permanent housing. So this is going to be a substantial shift in what types of projects HUD will want to renew or fund as new applications. Just another visual of what our current portfolio is. Historically, our rating has always supported permanent supportive housing as a strong intervention for renewal due to its effectiveness based on evidence, based on data, and that these are brick and mortar projects largely that have a lot of other investments, from capital investments, operating investments, and these are homes that people live in. It is permanent housing for people. We need to shift how we are prioritizing and how we are rating and reviewing projects in this coming year, this coming NOFO, due to some of the requirements that are in the NOFO HUD published last Thursday evening at about 4 p.m. Some of the language that we are seeing in the NOFO that will be embedded in what is called the threshold review includes information around not engaging in harm reduction services, not facilitating racial preferences, engaging in activities violating the sex binary in humans. And in some of the post-award and policy preference pieces, they include wanting to see cooperation with federal immigration. All of which is in contrast to what we saw last year and in prior years in the NOFO, where we were asked to demonstrate how we are addressing racial disparities, how we are ensuring that people are being served based upon their self-identified gender. So there's a very poignant shift in what COCs across the nation are being asked to review, asked to rate. The priorities that HUD has stated and put forth in the NOFO include wanting to end homelessness on the streets, a big emphasis around unsheltered homelessness, focusing on outreach and interventions, increasing self-sufficiency through employment, collaboration with law enforcement and first responders, reducing encampments, public camping, public drug use. Supporting that is to prioritize treatment and recovery. This would look at wanting to prioritize projects with on-site substance use treatment with wraparound services. They also want to see projects that are leveraging mainstream housing and healthcare resources. This could be Medicaid, FCS, this could be partnerships with behavioral health providers who are coming to projects. They want to see projects working to advance public safety. So again, partnering with law enforcement around stay in public spaces. They want to see a large emphasis on self-sufficiency and working on partnerships with workforce agencies, child care to allow people to increase employment and earned income, but a big focus on earned income and employment. They want to see projects that have goals and plans to improve outcomes, including that self-sufficiency, employment, income, entering treatment and recovery, and are encouraging COCs to think about various ways to do those things through reallocating funds from lower performing projects to higher performing projects, expanding high performing projects, transitioning grants to the preferred project types. And in doing so, wanting to minimize trauma, so ensuring that there is a trauma-informed approach to how we are navigating all of this. So the things I want to focus on with you all, particularly, is around how HUD is anticipating rating and scoring our local competition process and how those need to be embedded in our rating and review of all applications for this year. So first, there is an initial kind of project review. This is a bit of the kind of checking to say, are you managing grants well? Are you submitting reports? Are you achieving goals? What is your, rate of getting folks connected to employment? They want to see those for all renewal projects that they are doing, due diligence and grant management. I won't go into all of the details here because some of these are very hefty slides. A part of the renewal review is what will be called a kind of risk review. So for renewal projects, if it is a renewal, there is not a more detailed threshold review. It is assumed that a renewal, based on it being a renewal, has met the threshold to be a HUD-funded project. There will be two components to be reviewed that are not assumed for renewal projects. And that will be evidence of previously or currently conducting activities that subsidize or facilitate racial preferences or other forms of illegal discrimination, or conduct activities that rely on or otherwise use a definition of sex other than as a binary in humans. The other is evidence that a project operates drug injection sites or safe consumption sites, knowingly distributes drug paraphernalia on or off property under their control, permits the use of or distribution of illicit drugs on property under their control, or conducts any of these activities under the pretext of harm reduction. So those will be two components that HUD wants to see that we review in the decision around what projects we put forth in our funding application to HUD. After the eligibility review for all projects, there is also a project quality review and a quality threshold. This is mostly related to new projects, as renewals are again considered to have met quality threshold unless there are noted compliance issues. But new projects must demonstrate that they have capacity, financial management, and readiness to operate, and HUD can deny any new project with significant unresolved issues. And then the previous eligibility thresholds would also be considered. There will also be component-specific thresholds that need to be met, mostly for new projects. However, we are intending to embed some of these threshold reviews within our rating criteria, as that will strengthen our merit review score as a COC around our local competition. Notable threshold review changes include requirements to have participants engage in supportive services and to see agreements that state that this is a requirement. For transitional housing, they want to see 40 hours a week of services or activities per participant. What's the other piece? I think those are the main pieces in this regard.
Also, we have some questions coming through. Marvin?
Great.
Marvin? Oh, let's see.
My question is simple. Do we want to get through this before we start opening the floor for discussion? And now that's addressed to Kelsey. Do you want to go through it all? And then we can always cycle back and talk about these. These threshold changes are very impactful in my opinion, but.
Yep. If we can get through and then take questions, that would be helpful for my brain.
Okay, no.
Thank you.
And then looks like Ruby has, Ruby, you please go ahead.
Oh no, same answer. I'll wait. I can wait.
Wonderful.
I'm writing them down.
Things that we are wanting to ensure we have embedded in our rating criteria will also include rating projects for how they offer on-site or coordinated substance use treatment and supports, whether there are partnerships, how frequently, as well as the partnerships they have to enhance employment and economic independence for participants, whether that is with workforce agencies, having connections or doing referrals to employers or apprenticeships programs, connecting folks with childcare, transportation supports, with the overall goal of increasing employment, income, and long-term stability. Just a quick review on the types of eligible projects for COC bonus dollars. There are bonus dollars that will be available. We will be prioritizing supportive services projects, either as a standalone or street outreach, transitional housing projects, and there may be an opportunity for expansion related to our coordinated entry system and our HMIS. For our DV projects, these will be new projects that are dedicated to serve individuals or families fleeing or attempting to flee DV. It can also serve survivors of human trafficking. The eligible projects for those will be transitional housing projects. Historically, we have allowed for rapid rehousing, and there has not been the availability for transitional housing. Given the 30% limit on permanent housing, we are going to seek new DV projects that are transitional housing projects. My last slide for you all, perhaps, well, maybe not the most important one, but a very important one, at least in this context, is the updates that we are recommending to our rating criteria. We are recommending that we embed some new criteria, that there should be a threshold and eligibility review in line with the NOFO details. This would be a pre-review before going to raters, likely done by KCRHA. It could be done in a partnership with others who are deeply familiar with the NOFO threshold and eligibility. We want to include the extent to which participants exit to unsubsidized housing. This would be an HMIS criteria that we would embed. We would add rating related to on-site substance use treatment supports, service intensity, that projects have plans or demonstrated services of up to 40 hours per week per participant. And then adding in criteria around coordination with mainstream services, so healthcare, housing, connecting to SSDI or SNAPs. We are then looking to update existing criteria, which would include, with program components, adding a dedicated point allocation for support services only grants. We have not had this formally embedded previously. We would do a point increase for projects that demonstrate a 20%, that 20% of their exit with earned income. And for program priority, there would be an added component around permanent supportive housing and their focused population, and then increased points for recovery-based units. The final updated criteria would be around cost effectiveness. We have had cost effectiveness criteria previously, but just more explicitly calling in to CFR 200-404, which is around reasonable costs and just demonstration of reasonable costs. So the ask today from you all is to really affirm the strategies that KCRHA is taking to align our rating with what is being asked for in the NOFO. We do not have that final criteria. It has been, what is this, Wednesday? It is the 4th business day after HUD is published. We are trying to move very quickly. We have less than 60 business days to complete this. So we do need to move fast. And it might not feel perfect, but we are asking for your endorsement to move with us, move quickly with us, and kind of embed in that affirmation a little trust that we are going to put together the strongest application possible to retain as much funding as possible. And I am happy to take your questions. Shawna.
Hi. Sorry.
Hello.
So I one, I know this 30% limit on housing, before we've done 85% on housing. Does that mean that some of the funds then will be used on sheltering?
So the funds would, if a project that is a permanent housing project type seeks to apply and it is beyond our 30% cap, HUD would remove that project and remove those funds from our total. The other options that projects will have is to either relinquish funding, and if funds are relinquished, we would reallocate them. I am still sharing my screen to the above project types, largely street outreach or support services only, and transitional housing. Shelter
so
is not explicitly stated as an eligible project.
okay.
It would likely the piece that would be looked at that could potentially be embedded in shelter would be a support services only standalone project that's not focused on street outreach.
Okay. Then my other questions don't really pertain to us per se, if shelter is not part of this picture, but I know there's an emphasis on partnerships this year, and there's also an emphasis on substance use treatment, but it says on site. So what if the partnership is with a substance use provider?
We don't have a lot of details
Okay.
on what that means yet. I am also going to just put a little plug of like, if we can focus the conversation and your questions, like there's a lot of questions around the NOFO writ large. We will have a couple of dedicated information sessions just on the NOFO on project applications. So for this setting, if we can focus on our rating criteria, that would be helpful for my focus and brain.
Yeah. Okay. This was to help me process the rating criteria, but
yeah. Oh,
I
got
will
it.
hold off on my last question then and pass it on to Ruby.
Right.
Well, yeah, thank you so much for doing this here today. So I know, I have two questions. The first one maybe is too broad for this conversation, but I'll ask it. Some of these requirements would be requiring organizations to break like local and state law, it sounds like. And are we putting projects, themselves at risk legally, or would they be putting themselves at risk legally by complying here? Or does that maybe more of a question for a later time?
Yep, I am not a lawyer. I will speak to what we are working on doing in the rating criteria in order to have the strongest local competition related to what HUD has published in the FY25 NOFO. Things outside of that, that are outside of the control of the rating, I cannot speak to. Any legal issues, I cannot speak to.
Then my second question is more of a rating and ranking question. So in the past, I know that we've had maybe points surrounding, bonus points, I guess I could say. Is that going to be kind of, eliminated here? I didn't hear of any things that were being like eliminated off of our original kind of like bonus point systems. And so I'm just making sure that we're aware that I think in our bonus points we've had more inclusionary driven questions. And so what are we doing about that? Just frankly, yeah, thanks.
Any criteria that is antithetical or in opposition to what HUD has written in this NOFO will not be included this year. We are aiming to have as much clearly objective criteria, so HMIS data driven, spending driven, fact-based criteria as possible, in part because we want to reduce the amount of information that we are asking of providers in an application process. Those are usually pretty narrative heavy and very detailed. Given both the time we have for this overall process and time of year, knowing there are multiple end of year activities that providers are doing, we are intending to have as much clear objective criteria as possible.
Okay, great. And just my last, because that kind of sparked a second question, just and then I think Marvin also had his hand up and I want to make sure we get to him as well. So my question then is kind of delicately, by providing as little or as more objective and, like HMIS information you're saying, that kind of allows for organizations to still, to still have operational ideals and stuff like that, correct? Kind of, in a way. I don't know what to say right now. If that made any sense. I'm just saying, like, basically by not having a narrative answer, that can kind of allow to still have a narrative in their programs, right?
We are going to use as much objective criteria as possible, so that how programs are performing in terms of their outcomes is the highlight of those programs.
Okay, thank you for that.
Is it my turn?
Yep, Marvin.
Thank you, because I'm going to ask those questions just in a different way. What are we mortgaging by changing the embedded language that we previously had? What are some of the barriers that some agencies may face to organizations that once receive funding will not fit this new rollout? I'll start. That's question one.
At this moment, I can't satisfactorily answer that, because there are some things that we haven't looked at previously, so I can't give you a ballpark there. If we do not change our rating criteria, we as a COC risk not getting full points on our local process. In the merit review. The merit review is 130 points. 9 of those points are related to our local rating and review process. So we potentially risk decreasing our overall COC score, which decreases our national competitiveness, which decreases the potential number of tier 2 projects that we could get funded, whether those are renewals or new projects.
Understood. I like that answer for right now. The second piece is the new language is embedding criteria that requires organizations or agencies to do work that they haven't previously done. How has that been incorporated into our rating and rankings, and what is the time frame, if there's any, for them to be able to shift? Because the expeditious nature of this is not going to allow the smaller ones to shift fast enough to be part of a ranking or rating to keep their funding.
Yep. So around the part of the framing of questions, particularly as it pertains to newer components such as the service requirement, or the number of hours that are allotted for engagement or on-site substance, questions may be, what are you doing now or will be doing? So part of that will be in the framing of the question that is asked. Funding for FY25 will be HUD projects that they will be announcing and contracting that come May of 2026. So there is a little bit of time for some shifts in things. However, we are very, very aware of how fast and how significant all of these changes are.
Okay. My last question is really going to be centered on the optics around this NOFO. The requirement that 20% of exits have jobs. I counter, as I often did with the World Cafe yesterday, 6% of people experiencing homelessness have jobs. What they don't have is a pathway to get housing. And I don't see where in this application we try to reach the entire demographic space. It seems to be focused on, and there's nothing wrong with this, those most vulnerable or those who require better supports to return to housing. And it seems those are with the language that I hear and being embedded, that's where the focus of all of these dollars will go. And not nearly enough dollars, but do I have that right? That's my question. Am I seeing this in the right way? And then I'll pass. Ben's had his hand up for a while.
I can't speak to HUD's intent. It does appear that the focus is to look at federal dollars being used to support people to gain self-sufficiency and decrease reliance on publicly funded housing opportunities.
Thank you.
Ben.
Hi, Kelsey.
Hello.
I think that you taught me many, many years ago that, and it's been a while since I was doing this kind of direct service work, but something you were talking about made me think about this. I feel like I remember that COC funded units had a lower threshold for kind of like what was required for individuals to be able to move in, ID specifically. And so when I think about that, and then I think about what I saw that you said that we'd have to, or that they would have to work with federal immigration enforcement, what are the implications there? Am I on the same or on the right track here?
Yeah. I don't know. There hasn't been much expanded upon what that means by HUD. I am fairly confident there will be questions that are posed to HUD around what that means in practice. What we have right now is what's written in the NOFO. There's not really any further detail around what a number of the provisions they have included mean in practice.
Okay. I just remember that like the kind of like the documentation threshold was lower for COC units. And so
there is nothing that I have seen in the NOFO that would change any sort of documentation requirements upon move-in at this moment in time.
okay. And then the other thing is I heard you say that kind of like the focus is on you know, basically getting people back to work so that they're no longer dependent on public dollars. And I wrote down participation requirements, and I feel like that's something that we've kind of traditionally, at least in this area, been we tried not to have participation requirements. So could that be as, I think I heard later in your presentation that that could be as little as, you know, case management, and I'm hoping that that could be a thing, but do you know anything more, like any more information about like what they might be requiring as far as participation in whatever program it is that would be keeping them housed?
A little bit. So what is written in the NOFO is that projects are being asked to submit documentation of a service requirement, whether that be a participant agreement document, whether that be embedded in a lease agreement, an occupancy agreement, that align with 24 CFR 578.75H, which is around supportive service activities. Those include assessment of needs, case management, transportation, food, employment training, etc. So those are the types of services that are being asked to be a required engagement versus a voluntary engagement, which is a noted shift from how programs have historically operated, particularly if a program was more low barrier, there were not requirements for engaging in services. This is a shift to want to require engagement in services.
Thank you. I appreciate it.
Ruby.
Yeah, cool. Thanks. This has been enlightening, and just wondering, I think I'm going to start with isn't that why the COC was like created, was to have like, more housing and non-required services. Anyway, that's just wanted to basis in that. And then the other thing I had a question about was HMIS. You did mention a little bit about what was going to be funded project wise and like rated by if they're using HMIS, I'm assuming is what you were speaking to. And then also kind of like, what are the risks? Is there a risk of losing any funding around HMIS or coordinated entry is really what I'm kind of asking.
Yep. So any project funded by COC funds must use HMIS. The allowed funding around HMIS that's an eligible component for a new or expanded project. Your other question around our coordinated entry projects and HMIS projects, there are a couple of considerations that when we get to rating and ranking will need to be taken into consideration. I will say consideration 8 times. Historically, and in this NOFO, coordinated entry and HMIS projects are not rated because they have no project to rate against.
Right.
And those can just be renewed. Historically, because they are not rated and because they are statutorily required or regulatorily required, they have been placed in tier 1. This will need to be a decision with the rating and ranking around whether those are placed in tier 1, which is that more secured funding not based upon your merit score, or within tier 2. So that will have to be a decision that's made throughout the local rating and review process.
Okay. Yeah, because I did hear, and then also the bonus projects are in tier 2 as well.
Bonus projects can be in tier 1 or tier 2. That depends upon the local rating process and how they score typically.
Okay, and then final question on this rating process, I think for me, supposedly, is that, yeah, so that means that would take away potential spaces for other tier 1 projects, correct?
If we put coordinated entry and HMIS in tier 1?
Well, we would need to, right? And so I'm just trying, well, my opinion would be that would be something we would put into tier 1, and also like DV projects and things like that would, we want to make sure that we're funding those. And my concern is that, of course as we know, we need all of these projects and all of these programs like that we've been funding for years under renewals. But what I'm trying to say delicately is that we're going to have some ones that we absolutely need to fund. And does, HMIS and coordinated entry then would be not taking away, but be filling space that other permanent supportive housing projects could potentially be under tier 1. I'm just, yeah, I guess I'm just extremely concerned about this, I guess, and I think a lot of us might feel the same way. My concern is just that, well, what I'm hopeful for is that transportation is under supportive services only. And so, like, you know, would giving out bus passes potentially be something that could be considered transportation, things like that. I guess I'm just trying to kind of digest a lot of this information. But, you know, a lot of this has been best practice, you know, kind of what Marvin was saying. And so, are we like taking into consideration that if the NOFO press release has said like that they're going to be looking into the backgrounds basically of organizations or of the COCs and stuff, like are we concerned about receiving any additional funding, and like what does that landscape look like? I guess this is maybe more of a NOFO specific question, but sorry, I'm rambling. I'll stop. Thank you.
I'm not sure if it was Marvin or Tamara who had their hand up first. Forgive me.
I think it was Marvin.
Are you sure? My question is very simple. When is it due?
January 14th.
6 weeks.
Yep.
Okay, thank you.
Mm-hmm.
Yeah, my question is, are we allowed to use any of these the funding that we receive or the reallocation dollars towards prevention, like prevention work? Because that's the only way that, that I can think of to like do this mind shift without losing my soul. So I just wondered, like, if we can use some of this requirements to shift towards prevention, gosh, that would be at least a more palatable way of responding to these requirements. But I don't know if that's something we could do.
Only high-performing communities, as defined by HUD, are allowed to use COC funds for prevention. There is not a single COC that is designated as a high-performing community.
My goodness. Okay.
I have a lot of fun facts today.
Yeah.
Shawna?
Thanks, and sorry, Coco is yelling at the postal worker. My other question, you know, in another presentation I was at, talked about one of the HUD's grading criteria was that the COC did not have any or would grade higher if they did have things like camping bans and other ways that criminalize homelessness. And I know that's not our way of doing things here, so I'm wondering how you all are planning to address that. Or is there, are we just not
Yep.
going to?
So the piece that you're referring to is around public safety. There in the merit review for the consolidated application to rate our COC includes criteria that there are laws that we can cite that cover the entire geographic area of our COC. So this would have to be either a King County or Washington State law. From my awareness, we would not be eligible to receive those points.
Okay, so we're just planning. That's kind of what I thought we were. Yeah, okay. There's a question in the Q&A area.
Yeah, thank you for
Kelsey,
that.
it says if the NOFO press release language is accurate about reviewing past applications, we will be changing the rating and ranking to no longer align with our values and still not receive merit-based points.
We feel confident at this moment in time that we can write a strong application. There are various measures that HUD has embedded in the NOFO that may be challenges. At this moment in time, we are, as the consolidated applicant, going to do our best to put forth the strongest application we can to reserve as much funding as we can, and that will include needing to change rating and ranking. That is our job as the consolidated applicant, and we are going to do our jobs to the very best of our ability.
Yeah. Is there, oh, sorry.
Other questions?
Kelsey, this is Daniel. I want to just put forth kind of what Ruby had talked about earlier with HMIS, and just make it known that it is a considered a critical infrastructure for the community, and elevating at on the heels of the COC convening yesterday. For those of you who attend, for the public that's listening and may not know, we came together as a COC continuum with membership, and just looking at all the data and the data products that we're working on and things to really locally solve and end homelessness for the communities that we serve. I do feel that HMIS and coordinated entry are critical for the plans that we have in this region, and a loss in those two projects would mean a fundamental redesign. I also don't know how you would get required reporting done without it. And Kelsey, I know you and I are in close contact, so I'll be working with you as we go through this process to ensure visibility on HMI specifically, and then more broadly those critical pieces that would be a trade-off if for some unfortunate reason it was something that HUD didn't prioritize in our rating and ranking.
Mm-hmm.
Sorry about earlier. I was about to jump into like co-chair position, so I apologize for that. I was like about to ask if there's any other questions, but I'm concerned about having places to put people, even if we have HMIS, where will we be navigating, or coordinated entry, where will we be navigating people to if we're not funding permanent supportive housing? I just want to raise that. You don't really have to answer that question, but yeah.
Marvin?
My last question is, as you mentioned that there will be further listening sessions to how we put this together. Do we know the cadence or the schedule of that yet?
We have a timeline of events on our website on the COC page that includes a timeline of when we intend to release the applications for new and renewing projects, as well as a couple of office hour sessions, and then some sessions that are focused for direct grantees. So they receive the grant directly from HUD. They have some specific obligations. We have a one that is set specifically for renewing grantees. And then we have a session for folks who are wanting to transition their project component type. The ones that I would welcome more general questions would be the NOFO office hours that we have set for, I want to say November 26th and December 2nd, I believe. The other ones will be very focused. So those who are not ask questions outside of the scope, I will kindly ask to step aside.
Thank you.
Yeah.
How long are the office hours?
I believe an hour to an hour and a half.
Okay.
I will also note we do have a NOFO work group. That work group meets weekly. So we will be also meeting. So we've had an established work group since April, I want to say. So the NOFO work group is the key kind of focused body of individuals focusing on the NOFO outside of everything else. They're another kind of thought partner work group that is a COC work group.
Is that group open to others at this time?
It is currently at its capacity.
But for this purpose, is it open to others? I would say, like folks from System Performance or other board members.
We do have board members who are on that work group, and we will be providing updates at the COC board meetings on that work. But at this time, that work group is at capacity per the limit that's dictated in the COC charter.
So it's not open to others at this moment.
It's at capacity.
Okay. Another way of saying it. Thank you. No. Thank you.
Yep.
Next.
Tamra.
Yeah, I'm wondering if there, I mean, I'm always trying to look at different creative ways of kind of subverting or like circumventing barriers. And so I'm wondering, are there partners like advocacy groups out, other than the Seattle King County sketch, are there other advocacy groups or like partnerships that we can lean into to kind of do the work of building up that alternate system that we really want while we're doing the mainstream work of complying with HUD's demands? I just want to know, like, can we do both? But like with trying to find mutual aid to support the effort of building up this alternative system, because we need to build a new future, it seems like. And I'm wondering, is there creative ways, or is there a work group or an entity that we can focus some of our volunteer time or whatever, but to build something in the place of what currently exists?
So
maybe that's too much.
Sketch, yes, is coordinating a lot of efforts. There are also a lot of efforts happening with city council, county council. Those are entities that have impact. The National Alliance on Ending Homelessness also has a lot of resources that I encourage folks to look at in their personal time.
We have a question from the chat. Dorsal asks, state law prohibits DV service providers from requiring services of anyone fleeing DV. I understand you're not a lawyer, but how will DV programs be able to apply for any COC funding as just one example of legal concerns attached to these changes? I don't see a question mark here. Thoughts or comments, Kelsey?
This was actually a question raised in a session I was in earlier with the National Alliance on Ending Homelessness. There's not a clear answer to this question, but we are able to submit questions around provisions in the NOFO that are in contradiction to other state, federal, or local laws. And those are being sent and submitted to HUD if they can provide some clarity around those contradictions.
Thank you. And I know, Shawna, you had your hand up.
Any other questions?
Would this be the appropriate time to make a motion to recommend these changes to the rating and ranking
I
for this year?
believe we were being asked to affirm.
Oh, affirm them? Is it
The
affirm
use
or?
of the language moving forward. I may be wrong.
We have another comment in the chat. It's from Victor. He says, I don't have a specific question, but want to comment that this is very unusual process in comparison to past years. Thus, we will need to be adaptive and nimble to make this a successful NOFO process to maintain the safety net for the vulnerable unhoused communities.
Thank you for uplifting that, and I will definitely affirm that this is not a process we are used to. And as a consolidated applicant, we are also moving and hoping to move in ways that we historically have not and would not choose to. And that is, again, to be as competitive in this application process as possible.
And Kelsey, oh, I see Ben. Go ahead, Ben.
Hey, I hear that you have put together a comprehensive package that hopefully will get us the most money that we can to continue doing the work that we do. And I just need to name that I'm very uncomfortable with this. Not because you aren't doing a good job, but because of the, vast, like, sweeping changes that are being made. So I was just wondering if there's anything like anything that you can say that will make me feel more comfortable about doing what you're asking of us to either approve or endorse what you have said. I recognize you just gave a whole presentation. I don't know, just make me feel good about it. You see what I'm saying? Can you do that?
That is a tall order. What I will say is that as the collaborative applicant, we are trying to be as thoughtful, as strategic, and as anchored in ensuring that those who have been supported, housed, and impacted by our COC funded programs feel as little shifting as possible. That is our goal as a collaborative applicant. And in order to do that, we will be as strategic in how we conduct our local application, in how we write our consolidated application, and how we connect with providers who are doing this work. That this is not done in terms of like cloak and daggers. We will be posting all the applications, all the rating criteria as it is finalized and available. Our aim is to publish everything on Monday. And that things will feel uncomfortable, things will feel different, things will feel hard. We are in a very different NOFO process than we have ever been in before. So we, the consolidated applicant, KCRHA, are navigating something really new with you. So know that the butterflies you may feel in your belly, we feel too. And it is our job as the consolidated applicant to eat those butterflies as much as possible so that we can put forward the strongest application to keep as much of that funding coming to our community.
Yeah, thank you, Ben, for stating that, and thank you, Kelsey, for giving that perspective. I also too feel those butterflies that we're speaking of, and I think most of us in this region will be feeling those butterflies going forward. I think the butterflies are intentional. I think that this is I really, ever since COVID, like, hate this word, but unprecedented, it's like, it's really something that we've never experienced before. And that's the intention here. My expectation, or my evaluation of the situation would be, I did want to share a bit of hope in all of this, is that, someone shared with me that, in order to be kind of held accountable, you got to go through the court processes. And so, in order to go through the court processes, you have to apply and be, go through the motions as if it was a normal process. And so I encourage, though this is hard, a lot of us have been awaiting this moment. I think we've been waiting for this to trickle down and into our line of work. I think that we know that this is not what we stand for in a lot of cases of how the best practices have been done in the region and across the nation. And we do have to support that, if we don't go through these motions, then we risk, the loss of all funds. And so it's important to try to not, and as much as we can, uplift what we are doing in direct alignment with this administration. Unfortunately, we live in a democratic society where this is, but never mind. You get what I'm saying. We're in a new time. And so I think we need to try and help make the butterflies more palatable to eat, I guess. If that if that makes any sense, I hope that helps a little bit about this decision we're making.
We will use every tool in our toolbox, everything that is available to us to ensure we bring in the dollars we need to do the services we know support people.
Thank you,
Kelsey, I've
Ruby.
worked around you for a really long time, and so thanks for answering that. I know it was a large ask, and it sounds to me like this is what you think the best option is. And so I think at the beginning you asked for us to, grant a little bit of trust along with the questions that we asked. So I think that in combination, you've actually helped me to feel a little bit better about it. I don't feel great about it, but that's not your fault. That's because of what they're asking of us. So thank you.
If I could do a little heart emoji, I would.
I next raised my hand, but I do want to react. Ben, thank you for asking the hard questions. And Ruby, I agree with you. We can do hard things. And right now is our time and our moment to stand up and rise to the occasion and do what we think is right. And in that line of thinking, I do want to make sure that all voices are being heard today. I typically don't spotlight folks, but I have not heard from Victoria, Sherry, Kristina, or Mustafa, and I want to make sure as representatives of their communities that they get an opportunity to speak. So I do want to maybe in that order, if we could go to Victoria, Mustafa, Sherry, and then Kristina, and just make sure we're checking in with everybody. Victoria, anything you want to add, thoughts, concerns, questions?
Yeah, I mean, I think Ben has been articulating them. I think Tamara spoke to something to this effect earlier of like, I want to make sure that we are not abandoning our community's values without getting something in return. And I understand the value of maximizing our funding. So I just truly hope that these changes will do that. Yeah, I think that the biggest concern I have on this updates to the rating is that first bullet point of the threshold and eligibility review in line with the NOFO details. Just knowing that, I know Kelsey, you're speaking to wanting to do this with as much objective criteria as possible, database criteria. I don't know that these would be the sort of things that you could get from HMIS. So I'd be curious to hear any additional details you might have on that.
Yep. So some of the threshold and eligibility, HUD has some kind of clear checklist things, and those would be embedded in the project applications. So the applications that we open with the RFP for new projects and the renewal projects. So those will not be data based, but it will be a review of responses in the applications that providers submit.
All right, thanks.
Mustafa, I want to give you an opportunity in the lineup. Any thoughts, comments, concerns on your end? Anything you'd like to elevate?
I'm good, thank you. Just was listening.
Sherry, I want to give you a moment if you'd like to ask any question on Mike, thoughts, ideas. And then Sherry, if you do have some final thoughts, please on Mike. And I'll hand it over. Kristina, any other thoughts or top line items you want to bring up?
I'm good too.
Okay, I know I'm not the co-chair, but I do want to make sure that we articulate your ask, Kelsey, and get that vote before the top of the hour. I saw you put that in the chat. I think that's available for everybody. Want to just call attention to that for those members here that can bring a motion to vote, kind of temperature check. Are we ready for that? Do we need more discussion?
This is Kristina. The chat is disabled, so I have no clue what you're talking about.
I'll read it off here for us. So the ask is for a motion to endorse and approve for KCRHA as the consolidated applicant to change the rating and ranking that will make our process as competitive as possible with this year's NOFO.
Thank you. I will go ahead and be the first one to move on that. I would need a second.
Second.
Identify yourself because it doesn't say who you are. Or if somebody could identify who that was.
That was Shawna.
Thank you very much. All in favor of, I can go back with Braille and see what it says.
I think we should go one by one and do the vote. I'm going to hand that over to Curtis.
We still have to read it. All in favor for, I have to find the transcript.
Okay.
I don't know if we have to read it again because Daniel read it.
Okay. Thank you.
Yeah.
So go ahead and call the vote.
So, but are we endorsing or improving?
I believe we're affirming.
Affirming, excuse me. Thank you, Marvin.
Thank you.
Wait, is this not going, so is this endorsing to go to the board for approval, or I'm confused? How is this, does the board need to approve this too? How's this
Yeah,
working?
I'll answer that question. It's a bit technical, but it's very good for us to recap on this. So with the charter and the charter guidelines that we have, we actually, KCRHA is given the authority to operate the to do these operational functions, but we want to do this in community, so that's why we bring it for an endorsement or affirmation that we have agreement that this is how we want to move forward together. Technically, the guidelines allow us to just operate like this, but of course, we wouldn't be doing our work if we weren't bringing along you as representatives part of the COC. So technically, it's an endorsement, not an approval. Since that's already outlined in the charter for us to be able to execute the work. But certainly this is, you know, in ways, this is your personal approval in the form of an affirmation.
Okay, just for clarity, that's not how, I guess, well, this is an unprecedented NOFO situation, but I just want to make sure that we're all on the same page, that that's not how it has been and that's but okay, that makes sense. I believe I've read that in the charter as well. So okay, so for clarity, this would be approving and affirming these, right? To move forward with.
I'm gonna ask
I
Kelsey
wanna
to
be
just make sure we're
cautious
not.
of approving. We
Yeah,
are
I wanna make sure.
affirming the use of language. Please stay on topic. We're only affirming the use of language so that they could perceive in writing the NOFO application.
Correct.
Thanks for that clarification, Marvin. Just
Actually, let me clarify if I may. The ask and the role of the System Performance Committee, you all oversee policies and procedures. This is from the charter. This is on, let me give you the page citation if you all need it. This is on page 10, that the System Performance Committee oversees policies and procedures related to HMIS standards, metrics and evaluation, and ranking of the annual NOFO competition. So this is an ask for you to approve for KCRHA as the collaborative applicant to let us make changes as needed to the rating and ranking process to be as competitive as possible on a national standard with the NOFO this year.
thank you for that clarification. That makes a lot more sense. I believe I recall this in the past, so thank you. Okay.
Tamara, your hand is raised.
Yeah, I was just wondering, are we concerned at all about the language in the NOFO about if you either provide or have a history of providing services based on blah, 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 blah? Are we concerned about that? And like, it basically feels like they're threatening us to like be compliant or not get any funding. So are we, how are we responding to that?
We will use all of the tools that we have available to us to make sure that we are, as the collaborative applicant, following all federal, state, and local regulations,
Okay.
whatever those
Rules.
tools may be.
Okay, sorry. I'm, you know me, I'm gonna always poke the bear a little bit when it comes to things that I personally don't agree with. And so yeah, I think we should proceed with the vote. But yes, I think we're all on the same page with what we have to do.
Any other discussion?
Oh, this is Tamara. One last thing. We've got to, please join me outside of this space to like really develop an alternative way of doing business, because we're doing what we can right now, but we also need to be building something new. So join me outside of this. But yeah, let's proceed with the vote.
Okay, making sure, calling it again. No other discussion? Okay, go ahead and take roll call vote.
Okay. 1 second. Okay. Sherry.
Is Sherry still on?
No, I don't see her name. She might be here.
Thank you.
Forum then?
Yeah, yeah.
Shawna joined after roll call, so with Shawna we have another individual.
So we still have 8. Okay. Okay. Ruby.
I'm gonna abstain.
Abstain. Okay. Marvin.
I too abstain.
Okay. Kristina.
Aye.
Ben.
Aye.
Victoria.
Aye.
Tamara.
A reluctant aye.
Mustafa.
Aye.
And Shawna.
Aye.
Okay. So we have 6 yeses
Two abstains.
and 2 abstinence. So the motion passes with majority.
Yes, correct.
Okay. So the motion passes.
Just a word of thanks. This I know is not an easy process this year, and just really appreciate the thoughtful questions that everyone has raised, both on the SPC and those who were in attendance. So just very much appreciate it.
Thank you, Kels.
Kelsey, I think with the abstention, this is Daniel, with the abstentions and I think some trepidation we all have here, I wanna ask, actually what I'm gonna commit to doing is getting some updates for our Monday planning sessions with co-chairs and make sure that we're bringing you all along in this process. So I'll work closely with Kelsey to make sure that those go out to everybody, so that we're in community and we're in lockstep and arm in arm as we go forward, and I'm keeping everyone up to date.
No, thank you for that, Daniel. Appreciate it. Definitely keep us up to date. Yeah, I mean, I just this is a really tough moment for I think a lot of us. So thank you guys all for like helping us understand what's going on.
Okay, hearing no other discussion on that. Our next meeting is December 17th, where we will have updates and start and whatever else we need to finish for the end of the year.
Kristina, real quick, did I hear incorrectly that this was the last meeting for us this year, that our next meeting would be in January?
Not that I heard of.
This is Daniel. I just wanted to on mic here. In the previous years, we've taken a break for the holidays in December. And the third Wednesday of December, it falls on, let me pull that up.
17th.
On the 17th, right? You know, kind of right amidst the holiday season. I'll open it. I'll hand it over to Kristina on how, if we want to actually vote on that or continue with that meeting. Kristina, I'll let you kind of manage us through that.
I would like to see us meet on the 17th. We've got some stuff that we've pushed off and weren't able to be discussed today because of the urgency of this. What do you all think? Y'all are the one. Go ahead, Sherry.
So moved that we meet on the 17th.
Yep.
Oh, I just wanted to say sorry, I just wanted to say sorry. My phone died, so I was looking for a charger, and I'm not even at home. Cars in the shop, so I'm back on now.
Sherry,
Thank
we
you.
moved to motion to vote and the motion passed. Did you want to have your vote recorded for posterity?
Yes. It was yeah.
It was an aye, correct, Miss Sherry?
Yes.
Thank you, Miss Sherry.
All right.
So we had 8 ayes and 2 abstains. Correct.
Great, we'll
Okay.
get that recorded.
Ben, I see your hand.
I will be out of town on the 17th.
Okay. How about everybody else?
Me too, maybe. I'm gonna be out of town. I don't know yet. Because I tried to enable the chat saying enable. That's why. I don't know what's happening in the chat.
For those of us who are here, I think the big thing is making sure we finish the work plan. And we are ready to move forward into the next year. if we kill the meeting, then we are going to be trying to do all of that work and track the progress of the NOFO being filed. I just want to make sure we have time to do the work that, it's going to be necessary once all of the busyness subsides. That's just me.
So we need to have 6 people that know they're going to be there to have a quorum. Tamara, your hand was first.
Yeah, I really think that we may even want to schedule something before then, given the urgency of, well, this process, and make sure that we're, not working against each other. And gosh, I had another thought and it just escaped me, but I really do want to keep the meeting, because I think it is our collective responsibility, especially during this administration, to show up for each other. And I've got a lot of stuff going on in my life, but this is critically important to me and to my community. I believe we're all on the same page there. So let's continue showing up if and when we can. I know that that's a tall order in during the holiday season, but if you can, please come.
Ruby, your hand was up.
Yeah, quickly. I'll be present in December. But I do want to hold space that we have in previous years not had a December meeting, and just making sure that maybe if I second what Tamara said, that we could maybe change the date to a week earlier or something like that, because I know other COC work groups aren't in session right now. So just holding space for Daniel and the staff that would be needing to be present as well.
We could move it to the 10th and call it a special meeting. Would that work better for the 2 of you leaving town?
Let me look.
It would? Okay, good. He's looking. How about you, Mustafa?
Yes, I don't know yet, but my brother is so sick, so I don't know yet. Yeah.
We're sorry.
Sorry, I'm on an RFP review panel for Be Heard that day at that time, so I wouldn't be able to make it at Wednesday at 2.
That's also, for context, that's also the KCRHA open house. So we would have a lot of, we have a lot of invitations out.
Okay,
and
let's
most
keep
of the
it
staff would be.
Yeah. Keep it the 17th and yeah, Ruby?
Oh, my hand's still up. Sorry, nothing.
Yeah. Well, we've got 6 people who've said they can make it, and we can, if those who can't make it can provide any feedback on any materials that we send out. If you see that, yeah. Any other questions, or just, so do we necessarily need to vote on that? Because it's not in our charter that we don't meet. We usually vote to cancel. Since we're not gonna cancel, it's already a standing meeting date.
I think we're all right there with you, Kristina. Yeah.
Yeah. Okay. Let's keep together, and Tamara and I will get, if we have to have a special meeting about something, we meet weekly just about with Daniel anyways, we will get it out to you all if something comes up that we need to jump back into a meeting before the 17th of December. Otherwise, everybody enjoy the rest of their November month, and we will connect next month again. Thank you very much for y'all making it today. I greatly appreciate it, and appreciate those I was able to reach by phone. So have a great month.
Thank you. You too.